ASN thanks Otska America Pharmaceutical Inc. for support of this podcast.
Well, good afternoon, everyone. We are here on day one of Kidney Week 2022, and I am here with two VIP guests who I'm going to ask to introduce themselves. My name is Sue Quaggin, and I'm currently serving as president of the American Society of Nephrology.
And I'm Rachel Lennon. I'm a pediatric nephrologist and professor of nephrology, and I'm from Manchester in the UK.
And my name is Ananth Karumanchi. I'm a professor of medicine. I'm a nephrologist at Cedars-Sinai Medical Center in Los Angeles, California.
All right. Well, welcome to you both, and thank you so much for joining us today. My first question, actually, both of you have served on the program committee at Kidney Week. Could you just tell our listeners what your role was this year and last year?
Well, I was the program committee chair last year, and that was a very exciting time. We had a fabulous program, and was just a little disappointed to see that we couldn't do this in person. So it was really wonderful to be back in person, to meet the friends, and to sort of enjoy the program this year.
Yeah, and this is my first year on the program committee, and it's been superb, actually. It's been a really fantastic way to interact with colleagues, and that was initially remotely on Zoom whilst we got a lot of the planning underway. And then we had an in-person meeting in the summer to complete the preparation for the different sessions, but it's been a fantastic experience.
And you mentioned it is the first time we've been back now in more than 3 years. So would like to know what your own personal feelings are about that, and if you've heard from other participants already.
Yeah, so it's, I think one thing that you can't beat with the in-person meetings is the serendipity of bumping into people, the efficiency of interactions, and I think that's just definitely been my perspective and what I've heard from others. We can do a certain amount interacting online, but I think it's instinctively human to want to interact and do that in person.
Yeah, I would agree with Rachel. I think we're all social animals. This is a place where you come and meet people. As I look back at my own career, very similar to you, Sue. My first meeting meeting at the ASN was as a junior resident in 1994. And here's where I met Eric Nielsen and Terry Strom, who were both giant sort of physician scientists who just talking to them made me decide that nephrology is where I want to go. And I think particularly for the young people who are coming here, having an in-person session meeting is so wonderful because they can get to meet the next generation of superstars like Dr. Quaggin and get inspired. And so I do think that there's a huge void that we have when we have the Zoom meetings where these young people cannot really meet in person.
Yeah, I think that's so true. Rachel, I'm going to start calling you both by your first names. I know both of you, and please do the same to me. Rachel, when was your first Kidney Week meeting?
Mine would have been probably around 2004, actually, when I first came out of my clinical training to do a PhD, and I remember distinctly, actually, of all meetings, just how fabulous the interactive poster sessions when you come along and you're presenting your work, and that's just and still is such a fabulous opportunity to meet your contemporaries and the leaders in your field who come up and talk to you at length about your work, and that's been something that I have passed on to the trainees that I work with now as the real opportunity of this meeting, to present early stage work and get feedback from leaders.
Yeah, I think that's terrific. I think the reverse is also true as a senior or an old nephrologist now. I'm meeting the trainees, and the future of our field is so inspiring. And, this morning just walking through that poster session and seeing hundreds of people and those hundreds of posters, it just sent shivers. I think it was really fantastic. We had the National Academy of Medicine join us again for the second year. Last year, Ananth, on your committee, you had them join for the first year. I'm interested to know both of your thoughts, comments about that session today.
I think as Victor Zhao pointed out, this was an experiment that they did last year and was wildly successful. It was probably the most watched sort of debate. It was at a time, most people thought that COVID was behind us and not knowing that the new variants were coming. So just to have Dr. Fauci and all the luminaries during the time have this discussion, Sanjay Gupta, for example, chairing that, it was really the highlight of ASN. And while it didn't quite make for an in-person meeting, it was, I thought, done superbly. And I think the same year, this year, with Peter and their group, talking to us about what are the lessons learned from the COVID experience and how can we move forward, some of the challenges of preventing the next pandemic, I thought was extremely well done and lots of answers and lots of questions.
Yeah, I agree. And you didn't sort of remind us that Sanjay Gupta also said that nephrologists are the smartest physicians in the hospital. So I thought that was very good. But Rachel, I'm interested in your thoughts, and particularly given that you're in the UK as well, there was discussion. This really will need to be a global response.
Absolutely. I think there are a lot of takeaway messages from this morning. I think an outstanding keynote presentation, and just reminding us that there are things that we can do, actually. It seems sometimes as though the events in the world are out of our control, but actually, on an individual level, what we can do to contain this anti-science movement and to influence and engage. I think there's a really important point made about how can we gain trust if we're not engaging, if we're not seen? So if we're not interacting with our patients or the public until there's a major event like this, how do we gain that trust? And so that was, I think, a really important message and something that we can think about. And actually, how do we improve that engagement and communicate in the right way, so that we can push back that anti-science movement.
Yeah, I think that's a terrific point. I'm going to move on to what you're most excited about in the upcoming meeting. We're just, partway through day one, and we have 3 more days of a phenomenal program. So I'm interested to know what both of you are most excited about at this meeting.
Plenty. I mean, it's always such a packed program, and there's still plenty of people that I want to meet. We have a session on Saturday where we'll start to think about actually whether we need to reconsider how we name diseases and conditions that we see. I think that will be an interesting session, and it's bringing together actually research, clinical perspectives, but also importantly patient perspectives. So I think the program this year, as last year, has done really well to incorporate and bring in wider perspectives.
Yeah, terrific. Ananth?
I would say that just to echo Rachel's points, I think the program is just fabulous. In particular, I think you've done a fantastic job with your plenaries. I would say you've got all the way from a very basic science, perspective of vaccines and mRNA technology, how it's going to help us move forward to the next level of therapies, all the way to a very patient perspective, but also the NAM panel, thinking about how can we all effectively work together with other organizations, but also importantly to be able to communicate. We've done, obviously, the pandemic really taught us that science really works. For example, we can quite easily, with the turn of a button, we can develop new tests, PCR tests, to detect new viruses. We can make vaccines a lot faster, but we've failed in curtailing this anti-science movement. And so, that's I thought was a great discussion. And as physicians who are typically shy talking to media, we all have to learn and sort of try to. And this may be a good way to sort of prevent or even ameliorate some of the next pandemic if there were to occur.
Yeah. No, I agree with both of you on that point. I think it's critically important. As far as posters and poster presentations, any highlights for both of you? Too tough.
I would say that I always look forward to the late breaking sessions, clinical trial sessions. To me, as you pointed out in your plenary this morning, that about 10 years ago it was like going to a funeral where you have all these negative trials after negative trials. But the last 3 years, it's been amazing. We've had so many new class of drugs. So I'm really excited, and I'm sure the room is going to be packed.
Yeah.
And it's probably the highlight for me to go and see what the next generation of drugs are going to look like.
Yeah, absolutely. I think you highlighted that so beautifully in your opening address this morning, just how this is the time, and it's just so exciting to see all of the developments in front of us. And I guess we had in the session this morning on gene therapy and where that's at. We heard about the advances that have really come through in the last decade in hematological and immune disorders, and that's real, that's happening. And what it felt like in that session is that those possibilities are getting closer to the kidney as well, and that's really exciting.
Well, you both are phenomenal scientists in addition to being physicians. I would love to know where you think or see gene therapy. What diseases, from your perspectives, do you think that will be effective in, or some of these other newer innovative technologies like mRNA technologies beyond vaccines? So open it up. You can take it anywhere, any way you want.
Wow. I mean, I guess there's the things that we can think about now and the things that, may well come in from parallel fields. But I guess there are the monogenic disorders that we can, already think about strategies for gene replacement, even gene editing. I guess the big challenge there is getting those therapies to the right place and to the right cell at the right time. So plenty to overcome. I wonder whether we'll have developments in the next 5-10 years at the protein level, where you can start to titrate and reduce a protein targeted therapy, and particularly in the kidney diseases that we see associated with fibrosis. Is there an opportunity potentially to target protein degradation with some of the newer technologies?
Yeah.
I would say, just to follow up on Rachel's points, I think what we've learned from the pandemic is that you have this new sort of RNA technology where you could just simple modification with pseudouridine. You can now take an RNA that is much more stable and relatively less immunogenic, make it for the vaccines. But the bottom line is that you could use the same technology for replacement of genes. And a good example, for example, would be a protein that we commonly use, erythropoietin, which is expensive and difficult to dose, and maybe not as cost effective. An mRNA replacement, you could probably make the drug for 1/100 the price of EPO. And so things like that. There may be other proteins, for example, vascular endothelial growth factor, the heart, that's being tested now by Moderna and other companies. So I think there's lots of potentials. We'll hear about this meeting. I think as physicians, we're going to get used to a new class of drugs, not just small molecules and proteins and antibodies, but now we are dealing with mRNA drugs. As well as RNA interference molecules. Some of the pediatric diseases like hyperoxaluria has now been solved with the RNA interference drug, and perhaps finding the right monogenic diseases, and even using RNA interference drugs, but also down the line maybe even CRISPR. If we can get the drug to the right target, would be amazing. But I think the future is bright. If I were young, coming back again, I would say I would pick nephrology. I wouldn't want to go to oncology. Now is the right time. And it's quite exciting to at the field where we have all these diseases, and ultimately we can say we can cure kidney diseases.
Yeah, I think you said it very well. Rachel, I'm interested in the UK.
Yes.
Are you seeing a similar pattern? I feel we're just through our fellowship interview season here in the United States, and I have just been blown away by the applicants this year, as every year, but just inspiring and really engaged in some of these new innovations. And how is it over across the pond?
Yeah, I mean, I think we are similarly seeing an interest. I'm a pediatric nephrologist, and so I'm always impressed with the commitment that our fellows have that come into the specialty. I think we still need to work hard to attract and inspire, but I think the ones that do come out, and particularly those that take on research and combine clinical and academic training, there are great opportunities to do that in the UK, and we just need to make sure they're maintained and that they are attractive prospects.
I've also been very excited and encouraged by the incredible social media presence we have at Kidney Week. There is also a great pediatric presence here this year, and they have a particular hashtag and a TikTok channel as well. Ananth, are you planning on adding any TikTok?
Certainly not TikTok, but I would say I would certainly tweet some of these the key sort of lectures that I get interested in. I will tell you the one thing that that's somewhat different, let's say 20 years ago, 25 years ago, and again thanks to your leadership and others. There's a lot of women in nephrology, which is really a big deal. And when you open the program and you look at all the major prizes, the major lectures, you have at least a 50% representation of women in nephrology, which is terrific. I have 3 daughters of my own, and at least one of them might go into medicine. Wow. This is a great place to come and to be a nephrologist. You have so many great women leaders that can be role models for these young women who want to take up nephrology.
Yeah, well,
that is thanks to you, Sue.
Well, no, really not. But there really is a phenomenal community here, and I think very supportive. And as I mentioned this morning, I do feel we're a very inclusive community, and we really we wear our pride on our sleeves about that. And I don't know if you noticed in the plenary session this morning, the ceiling was done in rainbow lights. I thought it was a very nice plenary session room, and but that was done specially for Kidney Week. So I think we're going to wrap it up. I think we are out of time and have to get back to another session. But I really want to thank both Dr. Lennon and Dr. Karumanchi for joining me today. And to everybody listening in, enjoy the rest of Kidney Week.
ASN thanks Otska America Pharmaceutical Inc. for support of this podcast.